Hello everyone, welcome to our YouTube channel Merit. So in today's video we'll be talking about the lung volumes, the interpretation of lung volumes in humans by the process called as spirometry that falls under the pulmonary function test and its importance. So without further ado, let's get started. Before starting our video, let me remind you to subscribe to our YouTube channel and motivate us to make more videos in coming future to help you. Similar to gills and fishes, lungs are the primary organ of respiration in higher animals. We would like to discuss two physical entities that comes into play when we talk about the air inside the lungs. The first entity being the volume and the other being pressure. But today let's just focus on the first entity or the lung volume, also called as the respiratory volume. We'll also be talking about the lung pressures or the respiratory pressures in upcoming lectures. So stay connected to our YouTube channel. As the name pulmonary function test itself suggests, these are the tests that are performed to assess the proper functioning of the lungs. These tests are used to assess the respiratory fitness of the patient, or let's say to diagnose if there is presence of any respiratory pathology in the patient. Not only used as a diagnostic tool for the respiratory dysfunctions, but it is also used to monitor the progression of any respiratory disease. In addition, the pulmonary function test helps us in evaluating the efficacy of the treatment that a person is receiving if he is suffering from any respiratory conditions. And generally are safe, but there are some contraindications that some patients are prohibited to undergo pulmonary function test. Also, the pulmonary function tests are mainly effort dependent. It means you make the patient to expire or inspire to his fullest by giving his best shot. So patient cooperation is a very important factor in this test for obtaining optimal results. Now let's talk about spirometry, that is the most simple and the most widely used pulmonary function test. So we have this instrument called as the spirometer, or most commonly called as the student spirometer, which is an instrument that is used to measure different lung volumes and different lung capacities too. A typical basic spirometer is shown in this animation here. It consists of a drum inverted over a chamber of water. Now you might be thinking how the inverted drum is just balanced even inside that chamber of water, right? Since the water exerts some amount of upthrust against that inverted drum. But let me tell you that the inverted drum over the water is counterbalanced by an additional weight that is exerted upon the inverted drum. So inside the drum there's a breathing gas, air or oxygen, let's say, and when a person breathes in and out of the chamber, the drum rises and falls, and as a result, an appropriate recording is made in a moving sheet of paper, which is later called as a spirogram. So we have talked a whole lot about this instrument called the spirometer or the student spirometer right here, but let me tell you a fact that you're never going to use this spirometer in any of your examination halls or in any doctor's office. But the fun fact is that the use of this spirometer is only restricted to your physiology labs during your basic science phases. Since there's been a whole lot of advancement in the medical field, and we use kind of modern spirometers nowadays for the detection of any respiratory pathologies rather than this traditional type of spirometer. So yes, spirometer plots the volume per time graph, which is called the spirogram, in which the volume or the lung volume is measured in milliliter and the time is in second. There are these waves like diagrams that are drawn by a spirometer when the person expires or inspires, and the drawing is made on a moving sheet of paper giving the wave like appearances. Okay, so this graph basically is called a spirogram. So by looking at the spirogram of a person, you can figure out about the lung volumes and the lung capacities of a person. Basically, the status of a lung or how well the lung has been functioning. Now I'd like to give you a brief idea on how to perform a spirometry procedure. So, first of all, talking about the positioning of the patient is advised to be seated. There's a significance for such positioning, and a sitting position is suggested as there's a high risk of syncopal attack in some patients with underlying respiratory pathologic conditions, or there can be fainting of the patient, which can result in fall and injury. It is also advisable to the patient that the patient undergoing PFT or pulmonary function test should not smoke for at least an hour, as the smoking might change the breathing pattern. Also, the patients are not allowed to take larger meals for at least 2 hours before the procedure is actually performed. And also, it is advised that they should not wear tight clothing, since the tight clothing might increase the intrathoracic pressure, and as a result, the accurate value cannot be obtained. So, in case of any physiologic test, there is a normal range of value, and in this case, or the case of spirometry, the normal ranges are obtained from larger population studies of healthy individuals. But the normal value may vary according to the age, the sex, the height, and the ethnicity of the person who is performing the procedure. The pulmonary function test or the spirometry is performed for at least 3 times, and the maximum value is taken as the final result. And we take the maximum value because it helps us in assessing the maximum capacity or the maximum ability of the lung to function. And this way we can compare the normal value with the abnormal value if it is obtained in case of any respiratory pathology. Now let's talk about the pulmonary volumes and pulmonary capacities. So, for ease in describing the events of pulmonary ventilation or the movement of air in and out of the lungs, for ease in describing the events of pulmonary ventilation, which means the movement of air in and out of the lungs, the air in the lungs can be subdivided into 4 volumes and 4 capacities. Now, don't be confused with these two entities since they are different from each other. If there is a single quantity of volume, it is volume. But if there's a combination of 2 or more volumes together, it's called as capacity. So if there's a single volume, it's a lung volume. And if there's addition of 2 or more lung volumes together, it makes a lung capacity. Now repeat with me. Single volume, volume. 2 or more volumes, capacity. Remember this thing by your heart. Single volume means volume and 2 or more volumes means capacity. So yes, there are 4 pulmonary volumes, and let me tell you that if you sum up all these 4 volumes, you'll get the maximum volume up to which your lungs can be expanded. You can remember the volumes in an easy way by using the mnemonic TIER or TIER, in which the T means the tidal volume, I is the inspiratory reserve volume, E is the expiratory reserve volume, and R is the residual volume. Similarly, the capacities, which is a larger quantity or the combination of 2 or more volumes, are the inspiratory capacity, the vital capacity, the functional restore capacity, and the total lung capacity. Now let's deal with each of them one by one. What's the only thing you're doing right now? Okay, apart from watching my video. You're breathing, right? You're breathing quietly. And in a single quiet breathing, you breathe in and you breathe out. Now, if you carefully notice on yourself, on your body, during your each normal breath, you're inspiring some volume of air and you're expiring some volume of air. So that volume of air inspired or expired during each normal breath is your tidal volume. And its value is 500 ml or 0.5 liters. And in the spirogram or the graph, I hope you guys remember, the tidal volume appears like the smallest waves, like the tides of an ocean. So that's why it's called a tidal volume. In the similar manner, the next pulmonary volume is the inspiratory reserve volume. Now, by the word reserve, what idea do you get? Reserve is something extra that you have allocated. For examples, the reservations, the disabled reservations, the female reservations, and so on. So, the inspiratory reserve volume is the reserve volume of air or the extra amount of air that you can inspire. And by inspire, I don't mean to say by normal inspiration, because when you talk about something normal inspiration or by normal breathing, it falls under the tidal volume, right? Or a tidal inspiration. So that's not the case of inspiratory reserve volume. Instead, it is a maximum extra volume of air that you can inspire by forcefully inspiring, and it is over and above the tidal volume. So definitely the value is going to be more than the tidal volume, right? So the value of inspiratory reserve volume for a normal healthy lung is 3000 ml. Now try this with me. Breathe in with the maximum effort you can apply. Yes. Now the volume of air present inside your lung in this state is your inspiratory reserve volume. Now after the end of a normal tidal expiration or a normal quiet breathing, you have expired a normal volume of air or the tidal volume of air, which is 500 ml. Okay? But the maximum extra volume of air that you can expire by a forceful expiration after the end of a normal tidal expiration or after you exhale or throughout 500 ml of air is called as the expiratory reserve volume. Now do this with me. First of all, exhale normally. Now, try to exhale as much forcefully as you can. Yes, now this volume of air you threw out is your expiratory reserve volume, and its value is 1100 ml. I just made you forcefully expire your expiratory reserve volume of air, that is 1100 ml of air. Now you might think that your lungs are quite empty or airless, but does that really happen? No. There's this thing called as residual volume, and the literal meaning of the word residual means remaining. So residual volume is the volume of air remaining in the lungs after a forceful expiration, and its value is 1200 milliliters. So why do you actually need some residual amount of air in your lungs? Actually, it's this residual volume of air that actively participates in the gas exchange process in between the periods of breathing. Also, it helps in maintaining the contour of the lungs, since lungs is a highly elastic tissue and has a tendency to recoil. In some of the disease conditions in which there is the obstruction of the airway, such as in COPD and other diseases, there is an incomplete emptying of the air from the alveoli to the outer atmosphere, and hence there is the air trapping in the alveoli. So this air that is trapped, it adds up to the residual volume of air present in the lungs, making the final residual volume of the air greater than 1200 ml, which is normal. So we can say that the residual volume is significantly increased in obstructive lung diseases. Now let's talk about the pulmonary capacities. As I've already mentioned, the pulmonary capacities are the combinations of two or more lung volumes together. Since the word capacity is all about ability, so from the term inspiratory capacity, you might have got an idea that it's the capacity to inspire or to breathe in. So inspiratory capacity is the maximum amount of air a person can breathe in beginning at the normal expiratory level, which means after a normal expiration. As I have already told you, during each normal breathing, you inspire and expire tidal volume of air. So the inspiratory capacity comprises of the tidal volume of air you have inspired or the normal volume of air that you have breathe in during your single quiet breathing, plus the inspiratory reserve volume. Now recall what an inspiratory reserve volume was. It is extra amount of air that can be inspired by forceful inspiration. So the value of inspiratory capacity becomes 500 ml, or the tidal volume, plus the inspiratory reserve volume, which is 3000 ml. So the inspiratory capacity of a person becomes 3500 ml. So there was this term called as expiratory reserve volume, which meant the extra amount of air that you forcefully expired after the normal tidal expiration. And even though after your maximum forceful expiration, there was still some amount of air left in the lungs, which was called as residual volume, right? Now there's this term called as functional residual capacity, which means the amount of air that remains in the lungs at the end of your normal expiration. It means after you normally expire, your lungs still have some amount of air which contains the expiratory reserve volume and the residual volume. So the combined form of these two volumes is called as the functional residual capacity. And the value of the functional residual capacity becomes 1100 from the expiratory reserve volume and 1200 from the residual volume, which makes the sum 2300 ml. Similarly, vital capacity is the maximum volume of air that can be expired by forceful expiration after a maximal inspiration. It means vital capacity is the maximum amount of air a person can expel from the lungs after he first fills the lungs to the maximum extent and then expires to the maximum extent. So which volumes contribute to the vital capacity? Yes, first of all, it's the inspiratory reserve volume, because the person has filled the lung to his maximum extent, or he has inspired to his maximum extent, right? Then comes the tidal volume that normally occurs even when the person is normally inspiring or normally expiring. Also, there is an expiratory reserve volume, which is the volume of air that a person forcefully can expire. So the sum becomes 4600 ml. Now the total lung capacity is the combination of all the pulmonary capacities along with the residual volume. Since lung has some amount of air inside it always, right? So the total lung capacity is the maximum volume to which the lungs can be expanded with the greatest possible effort, or let's say his maximum capacity. The total lung capacity is contributed by the vital capacity and the residual volume, which is 4600 plus 1200, that is 5800 milliliters. So what kind of patients do you suggest to get a spirometry test done? If the patient presents you with a cough, wheezing and crackles that are the abnormal breath sounds, breathlessness or shortness of breath or dyspnea in medical term, and if he shows an abnormality in the radiograph of the chest, you can take spirometry as an investigation method for the diagnosis of the underlying condition. Pulmonary function tests are important tools for the investigation and monitoring of the patients with respiratory pathology. So spirometry can be used whenever you detect any kind of abnormality in the respiratory system. So yes, spirometry is not exclusively used for the diagnosis of the lung diseases, but it is even useful after diagnosis of the disease. For monitoring of these diseases like COPD, that includes emphysema, bronchitis and so on, interstitial fibrosis, asthma, and various kinds of pulmonary vascular diseases. Because these pulmonary diseases are not static, they progress over time. So to check the progression of the disease and to make a prognosis, we can use spirometry. Preoperative evaluation means the evaluation of a patient to find out whether the patient is fit for surgery or not. And by surgery, Here I am talking about the surgery of the thoracic and abdominal cavities. However, the same procedure, spirometry, is strictly contraindicated on patients who have recently undergone any surgery. I'll be talking about the contraindications of spirometry in coming minutes. After a lung transplantation has been done, there can occur various complications, which include rejection of the organ, infections, and a condition called as obliterative bronchiolitis, in which your bronchioles are inflamed and the lumen is filled with inflammatory substances such that your airway gets obstructed. So, the gist of the story is that a transplanted lung does not function the same throughout the life. So, to detect the degree of deterioration, spirometry will be indicated. Those were the indications of spirometry, and now I'll be talking about the contraindications. Spirometry is contraindicated in a patient who is suffering from myocardial infarction and has had a recent attack within last month. Since spirometry itself is a sort of exertional act, so you do not indicate it in patients who are at high risk if they perform strenuous acts, for example, exercises. Let's say in a patient suffering from unstable angina. If the patient does something exertional, then the chest pain attacks or the anginal attacks may be precipitated. So it's contraindicated in cases like angina and also just after a surgery. And remember, not preoperative, since the spirometry is indicated in preoperative cases. And similarly, in the case of ophthalmic surgery and in the aneurysm or abnormal dilatation of the blood vessels, as it might cause a rupture of the blood vessels when you forcefully make the patient to expire or inspire. Okay, so the gist will be that you will not advise your patient to have a spirometry test done under exertional conditions and in cases of increased thoracic pressure, abdominal pressure, and just after a surgery. Okay. Wrapping up the video, let me give you a short revision on today's topic. So let's recall the pulmonary volumes and capacities using this spirogram. Lung volume is the amount of air or the volume of air present in your lungs, whereas capacities is the combination of two or more lung volumes together. So the tidal volume, which appears like the tides of the ocean in this spirogram, it's the amount of air that you inspire or expire during each normal breathing. Inspiratory reserve means the extra amount of air that you can forcefully inhale over and above the tidal volume. And expiratory reserve is the maximum extra amount of air that you can forcefully throw out or you can forcefully expire. So residual, which means remaining, is the volume of air remaining in your lungs after you forcefully expire. So you can remember the lung volumes with the help of mnemonic TIER, tire. Similarly, the lung capacities is how much you can inspire, which means the inspiratory capacity. And the amount of air in your lungs remaining in your lungs just after a tidal expiration is the actual functional residual capacity. The vital capacity is the amount of air that you can throw out forcefully after you fill your lungs to the full extent or you inspire to your fullest. So the total lung capacity is the total capacity of your lung to expand, which is the sum of vital capacity and the residual volume. In the same way, we use spirometry, which falls under one of the pulmonary function tests. It's a tool to diagnose and monitor the staging and prognosis of any respiratory disease, and it's done using a spirometer. And ultimately, a graph called as a spirogram is recorded. So that's all about the lung volumes and spirometry. Hoping this video was helpful to you all. And if you like this video, do give it a thumbs up and subscribe to our YouTube channel.